My name is Noah Ivers, and I'm a family doctor. I'm also the lead research scientist on this study. Thank you for your interest in participating in the proactive, personalized postpartum mental health care study. In my clinic, when there's a new infant, the visits always focus on the baby. And it's not always easy to identify if a new parent may be experiencing mental health symptoms. In this study, we want to make it easier for both new parents and their primary care providers to identify and address symptoms of anxiety or depression. I want to thank you for your interest in our study. The goal of this video is to help make sure you understand what's involved.
Hi, my name is Natasha and I am the study coordinator. I will be your main contact throughout the study. If you decide to participate, we will identify your patients who are eligible for the study. That is, patients expecting a new baby. With your permission, we may contact these patients for recruitment. Patients willing to participate will be randomly assigned with an allocation ratio of 2 to 1 to one of two groups, the usual care group or the intervention group.
All participating patients will complete a baseline survey during their third trimester and a follow-up survey at 24 weeks postpartum. Any patient who expresses suicidality in their survey responses will receive a message with supports for suicidality, including local emergency department and crisis lines. You will be sent an urgent message via your EMR and fax. Aside from this, patients allocated to the usual care group will not receive any intervention materials. Patients in the intervention group will receive repeated electronic surveys via email to collect their EPDS score at 2, 4, 6, 8, and 12 weeks postpartum. Based on the patient's survey responses, you'll receive up to 4 items. 1. A summary of the survey responses in the patient's EMR chart. 2. A link in the EMR chart to a provider e-toolkit. 3. A message to you via the patient's EMR chart. And 4. A message to you via fax. Every time your patient completes a survey, the EPDS score will be used to triage patients into 3 categories. Patients with an EPDS score less than 10 will be triaged as low risk. They will receive a link to a personalized parenting e-toolkit. You will be provided with a link in the patient's EMR. If you click on this link, you will open the provider e-toolkit, which will provide guideline based on low risk category. Patients with an EPDS score of 10 to 18 without suicidality will be triaged as symptomatic. They will receive a link to a personalized parenting and mental health e-toolkit. You will receive a link in the patient's EMR chart. If you click on this link, you'll open your provider e-toolkit. It will provide resources including information on diagnosis, conducting a safety and risk assessment, treatment, and referrals. You'll also receive a message via the EMR prompting for a non-urgent appointment. Patients with an EPDS score of greater than or equal to 19 and or who express suicidality will be triaged into the higher risk category. They will receive a link to a personalized parenting, mental health, and emergency services e-toolkit. You will receive a message via EMR and fax prompting for an urgent appointment. You will also receive a link in the patient's EMR, and if you click on this link, you'll open the provider e-toolkit. It will provide guidelines including what to do if there is evidence of self-harm. Our hope is that the e-toolkits you will receive will enable you to efficiently provide evidence-based and patient-centered care for your patients. Thank you for watching this video. If you have any questions, please feel free to contact myself, the principal investigator, Noah Ivers, or the study coordinator, Natasha.